Since it's Respiratory Care Week, I wanted to do a video about respiratory therapists. So I'm going to go over all the different specialties that you can get into if you are a respiratory therapist. First, you have your ICU RT. In the ICU, you're going to be managing your ventilator patients and critically ill patients. Next, you have your high acuity RTs. In this, you're going to be in a high acuity or step-down unit, which will be kind of in between the ICU and med-surg. A lot of times when you're on this unit, you're going to be dealing with a lot of BiPAPs and high flow. Next, you have your CS ICU RT. This will be more of a cardiac ICU. This will mostly be your post-CABGs, any kind of high complex cardiac issue, and even ECMO. Then you have your ER RTs. ER RTs get to see all kinds of stuff, but the big thing is you're there to manage the airway. So whenever there's a rapid response or a code, you're going to be at the head of the bed, making sure that the person is breathing. You deal with a lot of trauma as well as airway problems where a person just can't breathe. You have your RTs that work on med-surg. These RTs are going to be doing a lot of breathing treatments, maybe even some percussion, postural drainage, dealing with vests, just different things that aren't really critical enough to be in an ICU, but you're still going to need to get a lot of good medical care as well as education. So there's a lot of patient education that goes into respiratory therapists' work when they're on med-surg. Next, you have your NICU RTs. Here you're obviously dealing with your premature and very tiny little babies most of the time. You'll be dealing with them on ventilators, CPAP machines, as well as giving surfactant, which is something that will help their lungs mature. Then you have your PICU RTs. So basically the same thing. This will be for pediatrics though. So you'll be dealing with the ventilation, percussion, postural drainage, nebulizer treatment, stuff like that. Next, you have your bronch RTs. Bronch RTs get to assist with bronchoscopies as well as alveolar lavages, which is just you're cleaning those lungs out. Then you have your pulmonary function RTs. So these guys specialize in pulmonary function testing, which is used to identify people who have breathing problems and try to break it down into what disease process is actually going on. Then you have your transport RTs. So these guys are going to get patients where they need to go. So a lot of times they'll be in ambulances, sometimes even in flight, but that's more rare. But basically you're just getting a patient from point A to point B. Usually these patients are going to be critically ill. Then you have your educator RTs. So these can range all over the place, but RTs they can teach CPR. They can also be big into just patient education going around, especially if you have like an RT navigator in a hospital, trying to reduce readmissions for certain things like COPD and congestive heart failure, but all about education. Then you also have your educators that actually teach students. You have RTs that are big into research. Think clinical trials, different innovations, as well as studies and protocols. You have your home health RTs. These guys are going to be coming around bringing your oxygen. They're also going to be managing your at-home CPAPs, BiPAPs, ventilators, just trying to make sure that the whole family is educated on everything. Another big one is a sleep RT. So sleep RTs or polysomnographers will be working with people on different sleep disorders. So you get to watch brainwaves while a person sleeps. There's a lot more to it than that, but you get to deal with different sleep disturbances, primarily sleep apnea. You have your RTs that work the hyperbaric chambers. So this is another really cool thing that RTs get to do is to work in and manage those hyperbaric chambers. RT sales. So you can also get into sales when you're a respiratory therapist, especially respiratory equipment. So this is going to be like your home BiPAPs, CPAPs, ventilators, stuff like that. That it's a growing field. They used to have a lot of non-clinical people do it that are just really good with sales. But they're starting to realize that the clinical specialty of a respiratory therapist is very beneficial to those roles. RTs do all kinds of things. If you have any questions, just drop them in the comments.